Let me ask you a different question. That's something that's been put to me because of the views that I've expressed about this issue. There are people in the disability movement who believe that it's a form of discrimination to have a different attitude towards preserving the life of a baby because that baby will have a disability, even a severe disability, than you would to prolonging the life of a baby without that disability. So in other words, they are really, I suppose, saying all lives are equal and we should put as much effort and resources and so on into saving the lives of any baby that we can save, irrespective of what kind of disability that child might have. What's your view of that point of view?
Well, I agree that disabled people live lives worth living. And so I do, to some degree, agree with the disability advocates and activists that say a disabled person's life is worth living too. I think that there are some problems with making the decision about neonates using that filter. And that is that, first of all, it's the parents' choice because they're considering what the best interest is for their child. And yes, there are parents that are discriminating against disabled children, but that is their right in choosing who they have or who they keep alive when the child's born so prematurely. Okay, so that's one aspect. I do think that we should be allowing more disabled children to survive, and we do, actually. But I also think that there's another issue, which is we put in a lot of money for using high technology to save these tiny babies, but we don't put the resources into making sure that people with disabilities can live comfortable lives. And I think that's something that is a mistake that we have a little bit off our topic, but since you brought it up, I think it's a really big problem. So I see older children who can't get the most basic accommodations and end up having to live in ways that we wouldn't want anyone to live. And I'll give you a quick example of a child I saw in a clinic who was in a wheelchair, had to use a wheelchair, and had gotten bigger, and his parents could no longer lift him up into the bathroom. Now, there are some special seats that can accommodate a child and help swing their legs into a bathtub when they're paralyzed, but his parents couldn't afford it. And so they had to hose him down in the backyard to bathe him. That, to me, is really unacceptable. We spend so much money on keeping people alive, but we don't consider what we can do for them when they're disabled. I think it's really, and I think we would reconsider what it means to be disabled if everybody could afford all the accommodations that we need for them.
Yes, that does sound like an extraordinary contrast of resources, because I presume to keep these premature newborns that we're talking about alive must cost hundreds or maybe thousands of dollars a day, really, to maintain them, right? And the cost of this chair that you mentioned is, a tiny fraction of what we're spending to keep those babies alive, right? Yeah. I think there are certainly some good questions there that need to be thought about. But let me go back to this question again, to the idea of whether life with a disability, no matter how severe the disability, is worth preserving. Because I had the sense in the first case that you talked about, the case of Heavenly Young, not just you, but you mentioned that she talked to other doctors. I had the sense that you and the other doctors were hoping that she would say, let's stop treating this baby. That you talked about the EEG, the brainwaves being almost flat. So is it because, and you also said, I think, that probably this baby would be institutionalized because her mother would not be able to care for her. I mean, if you really have a future like that, do you think that you would still regard that life as being of equal value with the life of somebody who has a good prospect of getting up and being able to walk and talk and relate to their parents and friends and so on?
I actually have a friend whose daughter has some severe, some would consider profound disabilities. She was actually told that her EEG was almost flatlined. She had seizures at birth. She was a full-term baby, and so but she wasn't on the ventilator, so there wasn't an option about withdrawing a ventilator and giving comfort care for her parents. She is now a teenager, almost into her 20s, and she has really advanced incredibly compared to the prognosis that her parents were given. So it wasn't until she was 3 that they even realized she understood them. She uses a wheelchair. She needs to be strapped into it because she can't sit up on her own. She uses a communication board to communicate with others. She's able to program it, so she programs sentences in or names in that she wants to. She finished high school. She was mainstream for a while. She's quite an extraordinary person. She has a really outgoing personality, so she did have friends in her mainstream classroom. And now she has 3 part-time volunteer jobs where she works, sometimes communicating with patients in a rehab facility and a few other jobs that she works at. So I asked her when I saw her a few months ago if she liked her life, and she vigorously agreed that she liked her life. Her parents wouldn't have it any other way. And sometimes I wonder if parents can be honest about it, but I'm clear that her parents are honest about it. So is her life as valuable as mine? I think so, absolutely. I don't think all parents would be able to do that with her. And the problem is that a lot of those kids end up in institutions and don't have very good lives. And I think that is part of the decision that parents have to think about when part of the decision is thinking that their child might end up in an institution. Not every parent is able to do for their child what my friends are able to do for their child.
Thank you. That's a really interesting story and a moving story. To go back to Heavenly Young, do you think that it's possible that if you'd continued to treat her, if her mother had said, no, I want to insist that you continue to treat her, that she would also have had as good a life, would have recovered to the level of the child or the teenager that you were referring to then?
I don't know. I think that there's probably more patients that really do end up with the prognosis that was given than those that don't. But I don't know that for sure. I see now how I used to prognosticate about something and I now know it's not true. So it does worry me. But I think in that situation, her mother wouldn't have been able to give her what she needed. It costs a lot of money to take care of a disabled child, and it takes a strong person to advocate for their child so that they can get what they need. And I think that is a big part of it. I don't think Heavenly's mother could have done that.
So we're again getting back to the question that there's no lack of money for treating extremely premature babies, but there is a lot of great shortage of money for helping parents who perhaps don't have their own money to do it, to take good care of their disabled children. Right. Okay. Well, thank you very much for all of these issues. I'm not sure whether there's anything else that we haven't covered that you would like to talk about, that you would like to add something to. I think I've probably dealt with most of my questions, but if there's something else that you would like to mention, I'd be happy to have it.
Yes, and this is something I said in the op-ed I wrote. I think it's very important for people, especially young people that will have children or are in the midst of having children, to think about what they would do in this situation, what their values about life are. And I think that's important because if they're in this situation, the emotion gets to people. And so I would say for every young person, go home, talk about it, talk about what your values are. That will clarify things when you are in that situation. And my experience is that when parents know what their values are about life, they have a much easier decision to make.
Thank you. Well, that's certainly what we're trying to do in this course. We're trying to help people to clarify their own values in a whole range of different areas. And I imagine that we'll have thousands of young people who will have been listening to what you've been saying now, and I hope that they will go away and discuss it with their other friends so that it spreads around to thousands more, and in that way we contribute to having a better educated public thinking about these questions, not just in the United States but in many other countries where these decisions have to be made as well. So thank you very much, Dr. Dvorets, for being with us as part of Practical Ethics. It's really been a pleasure and a privilege to talk to you. And as I say, I look forward to getting the response from people listening to us.
Thank you, Professor Singer, and it was a pleasure joining you.